I'm often asked, what's the process of a fertility doctor? I'm Dr. Sharon Moyeri, owner and founder of OC Fertility. First, you're going to have a consultation and you'll have some testing to figure out if there's any specific cause for the infertility and to get an idea of your fertility potential. This includes often blood tests, ultrasound, sometimes an evaluation of the uterine space, either using X-ray, ultrasound with fluid in the cavity, sometimes a camera. If you have a male partner, your male partner is going to have sperm testing, as well as some blood tests as well. Once you have all the blood results back and the imaging tests back, then you can devise a plan. The testing should be completable within 1 month, and then you can regroup with your doctor to come up with a plan. Once you have your plan in place, then you can start treatments, and depending on what you decide to do, whether it's correcting whatever might have been identified as a problem, moving to treatments such as intrauterine insemination, also called IUI, or in vitro fertilization, then you can begin that process. It's often going to involve planning depending on which treatment path you go through, and some treatments are going to require more planning and more time involved. In vitro is going to require some carving out of time from your schedule. Not as much time as a lot of people think. Retrieving eggs takes about 2 weeks of injection medications leading up to the egg retrieval process. And then when you're planning to do an embryo transfer, that process usually takes a few weeks of hormone replacement. You're often being seen during that time, maybe once a week or so, depending on the specific protocol. And then you would usually have some bed rest once the embryo goes back in the uterus. Depending on where you live and what resources are available in your area, oftentimes the fertility doctor in our area will continue to follow you for the first trimester, which is generally the first 10 to 12 weeks. During that time, you might be on hormone replacement or you may not be, depending on your specific situation. And at the end of that time, you get transferred back to your general OBGYN. And the difference between a general OBGYN and a reproductive endocrinologist, which is what I am, is just the kind of training. So a general OBGYN has the 4 years of OB training after medical school, which we complete as reproductive endocrinologists. And then as a reproductive endocrinologist, we complete another 2 to 3 years, depending on when we trained, to get subspecialty training, additional training in fertility and hormones, reproductive hormones. So at the end of that first trimester, we send our patients back to their OBGYN to be managed throughout the pregnancy. And at that point, the OBGYN manages if there's any hormones that need to be maintained, but typically patients are off hormones at that point.